Good morning. This is Shamakacharya and this is my NEHA Courses summary that I've done for my internship, even though I did not got any position at any of the companies that I had applied for since December of 2020. And there are a bunch of courses that I have taken to fulfill my internship requirements. Here are the courses page that I had to come to, where the ones highlighted in red at the middle of the page are the NEHA courses in blue at the top and the FBA courses at the bottom. And on the top right corner that is surrounded in red is where all my courses that I have gathered would be located. And if we go to the next page, or should I say the next slide, is where you'd find them. And this is all the NEHA courses that I have gotten and piled up. Ranging from all the safety protocols due to COVID-19 and the environmental and land reuse certification program. In this slide, there are a few themes that keep popping up when it comes to the spread of disease, and in any kind of infection, whether that is COVID-19 or the common flu. And it's like contact with infected people, and how do those people get infected is that they come in contact with surfaces that contain the bacteria, fungus, or virus that are the source of the disease. And this is due to contact with different types of fluids like air and water, which those agents can go through as well. And utilizing different methods of controlling the spread of disease, which include environmental health justice policies, good air quality control, and policy incentives to improve the standard of living for both minorities and privileged communities that could have potential benefits for the population as a whole. And public health professionals need to be praised for their hard work, for being the professionals in fighting those kind of disease spreading, as in the case with COVID-19, in which we have to listen and follow their guidelines to help improve our health and well-being, even the health of our own communities. Here, the first bulletin is about how getting rich quick at the expense of land and the people there will just won't help. If an infectious disease comes out, it just will just drop all the hard work and effectiveness down the drain, which is pretty much throwing a wrench into the system. And everything else associated, livelihoods and everything else will goes down in the drain. And with unhealthy living conditions, people that work in those environments will be at worst and won't have no way of getting out of the system. And the best practices is the way we do business and to prevent the spread of disease without losing productivity, in which we can do two things at once without risking health for quick profits. We need to consider health as one of the aspects of profits and business equity. Here are the industries that are being affected by COVID-19 as of 2020 and 2021. The first one is the cannabis industry, then the food industries with restaurants, retail, and home kitchen restaurants. And inspections, and then lessons and classes on how to stay safe during this pandemic. There are policies in place to keep people and employees safe, but they are barely followed. And each state has its own policies and regulations when it comes to the cannabis industries. And that's why it's fragmented and or contradictory. And these are the different usage on how cannabis can be utilized with recreational, medical, and personal usages. Here are the two aspects of the cannabis industry that affect both the employees and the patients. For the employees that are working in the cannabis industry, the things that affect are ventilation, working conditions, and lack of health transparency. And for the patients, there are not lack of safety protocols to prevent the transmission of infectious diseases and lack of education about the products and how to use them properly. Here are the few tactics that are in place for the food industry prior to the current pandemic, but there needs to be a few changes. On top of the current foodborne prevention programs. And one of these is like this for special dining restaurants, you need to adjust to the takeout order, and there needs to be new training and using different technologies for processing and picking up orders. And these are a few techniques using QR codes, which I have not seen before, calling the restaurant so that you have arrived, just like the one for a hospital that I've been receiving for when I have to call Baptist Health for my doctor visits. Cleaning and then circulating air in restaurant settings, and in self-dining restaurants, so where you have to adjust as well, rather than where I can go and pick up whatever I want by serving myself. And there needs to be protocols that need to be placed there. Few protocols that are mentioned here, one of them involves inspections, and there's like some kind of food processing tracking system that goes from farm to my plate. And then different platforms, not just for traditional grocery stores like from Amazon, Whole Foods, or Meijer, or Kroger. Then also reaching out to multiple audiences using different forms of media like YouTube, Facebook, and Instagram. And then using different technologies like artificial intelligence to identify potential hazards of certain foods from foreign lands to the dining table. That way, to keep people safe if food comes from outside the United States. Practices that I've mentioned when it comes to food in the previous slides also apply to retail, like with good sanitation practices, keeping sick employees at home, continuing good hygiene practices that were being performed prior to the pandemic, best practices for reporting treated like a natural disaster, and then clean facilities, just like for restaurants, and follow the same food code practices before the COVID-19 pandemic hit. During the current pandemic, there are some few issues when it comes to startup kitchens that happen just from people's home. Like, people cannot sell food outside of the state if they don't know what are the regulations, and lack of food data for that same reason when it comes to foodborne illnesses as compared to the ones for retail stores and restaurant chains like McDonald's. 46 million cases are estimated from the CDC. And these are the prices for hospitalizations and the amount of deaths. And these are also due to pathogens. And the bottom slide is what I have just described just a few seconds ago. Is my first work product that explains what the presentation is about. The aspects of it are the same, with the Kentucky legislation for all Kentuckians should follow when it comes to food safety protocols. And this is just a summary of that presentation. And when it comes to inspections, the disease triangle comes up, and the host, like the people that are infected, and that's what epidemiologists study. The pathogens are what laboratory professionals study, and the environmental health specialists study the environment in which the disease have occurred. and this is from farm to plate. In the environment slide at the environmental tab at the bottom goes into detail about the practices on how the disease happened and spread to people. Pandemic, there have been different tactics utilized to do inspections rather than just going to the facilities, since people are working from home or from remote places. And then these are a few things here in the slide that add new ones till they're comfortable, and this is listed, and then there are some limitations that could be hindrance. And then restaurant food facilities are the only provide out takeout. What is your plan based on the following spots? And these are the questions set told from a script. Unlike basically what restaurants have closed due to how COVID-19 affects, and some of these also apply to some local stores as well. Here are a few ways that virtual inspections are occurring for Apple users. FaceTime is how it is going, and this is an example from the Hawaiian Department of Health. And then from the facilities side, it's sort of like making a movie with a director, cameraman, and this meeting is held is scheduled ahead of time, and there are some limitations such as due to internet connectivity. And then the technology hardware itself and what software to use. Here, South Carolina had experimented with virtual inspections, and there are some limitations. And have to provide disclaimers in which they have to provide transparency, like knowing that this is just a limited outreach of their inspection procedures. And this will end with the health inspector providing instructions on where to go by explaining to other humans on where to direct them in their facilities. This way, the people actually doing the directing in the facility side of the meeting can learn how to self-inspect and better be prepared for the health inspector in what he or she expects of them and what is required to be better prepared, and ways to keep the facility safe and clean for both visitors and their employees to stay safe. To be provided in person are now being virtualized through webinars and Zoom meetings, just like the classes that we have right now. And this is like what is possible due to limited resources and different ways of how to reach the thousands of people that want to learn the rules. And here is the Environmental, Health, and Land Reuse Certification Program summary of what courses or modules I had to complete in order to get this certification. This is regarding land reuse sites, brownfields, and Superfund sites. Here is the first step on how to go about making an impact in the community is to engage with your community members and to identify who to pick for being in your team to make an impact, and basically knowing what roles you have to be. For me, as a public health professional, and you have to pick the right way of communicating my message. And I need to know better. I need to know toxicology terminology. And here are a few ways of explaining the different ways of disease transmission, like inhalation, basically breathing, ingestion, eating, and direct contact, like with touching an infected surface. And like what is impacted by the land reuse site, and how do those places like factories have on the land. Here, we need to do is bring in community members that live in the community who has a similar goal of improving his or her goals, more like the community to improve the health and well-being of the member and the land. And the community planner manages the logistics of the redevelopment project. Municipality agency or organization like a local government and a health professional, environmental health professional like myself, knowledge about what I had just mentioned in the previous slide, and engaging with community stakeholders on the ways to mitigate or reduce the health effects of the land reuse site, just like where a factory used to be that had shut down. And the rest of this set of modules follows what I had learned in my capstone course, and that's what makes me feel like I had learned without even realizing. Here is a brief overview of what toxicology is and what is relevant in regards to understanding toxicity and all the terminology for measuring toxic substances. When it comes to NOEL and NOEL. And here you can pause to read more. here on the left is a review in picture form of the different ways people can be exposed to a substance or any kind. And on the right is a graphical representation of Noel and Lowell as described in the previous slide. Here, this talks about the roles of epidemiologists and how they help to keep people safe. And here, environmental epidemiologists try to identify the hazards and how they contribute to the health of the population being affected. And incident rate is the number of new cases divided by the entire population at risk, and prevalence is the current cases divided by the entire population. And Dr. Marion has done a video about how to calculate incidence and prevalence and with a 95% confidence interval. Practices in identifying the risk factors of the targeted land. And these include hazard identifications, like with identifying pollutants, and the dose response assessments, health problems at different levels of exposure with NOEL and LOEL, and using how much of the pollutants are people exposed to during a particular time and how many people are being exposed. And risk characterization, extra health risks for the exposed population. And here are the places where to do assessment, and this is just the two phases on this slide about where to get the information about conducting the site analysis. You can read more by pausing me. Approaches on how to do cleanup. With environmental impact, site-specific data, site-specific risk assessment. Like how to communicate effectively with different people without terrifying them when it comes to health hazards in the environment. And this involves trusted individuals and sources for the community that people can go to, and knowing the audience on how much they are willing and what reading level you need to use, like for children versus adults. 7 rules to consider when communicating risk to the target population or audience. Here is an example of a health message map on the left regarding asbestos, and this is the outline on the right on how you should go about creating one. And this is from the ATSDR's website, which is part of the CDC. Here in Module 4, Redesigning with Health in Mind, there needs to be cleanup procedures as shown in the left before anything can go forward. First is to identify, prioritize contaminants and hazardous materials and different pathways that they can take. And how is this going to be affecting people for its future repurposing? And these cleanup methods need to protect the health and well-being of the future users and implement those goals with the health of the people in mind. Here on the right is an extension from the previous slide, and here are the methods for a community vision, like with is to evaluate, plan, and act in a circular triangle to measure if the intervention is going smoothly or not, and if not, you can improve. And on the left is to consider the social determinants of health of who is being affected of the health of the cleanup process of the land reuse site, where like a factory used to be. On the left is an action mode approach to redesigning the old facility with health in mind, with the 4 steps. And all stakeholders need to work together to improve the land with the health of the people in mind. And health field sites address health-related issues like crime, access to health care, contamination, and exposure to hazardous substances and toxins, employment opportunities, and access to healthy food, and recreational and green spaces. Module 5, Measuring Successes. There are 3 major aspects here. 3 being the environmental success, the health success, and the success of the local economy. Track both physical and environmental health of the community, in which, with all of these 3 being so well, the health of the population will also become better. Is a slide from the ATSDR presentation that differentiates issues from indicators from outcomes. You can pause to read more. Second work product, and this goes on a step-by-step process on how to convert the other side of I-75 on the Barnesville Road into a recreational park with playgrounds for everyone to enjoy. Like, in the ways I would do is gather records from the sources that are related to that geographic area, from sources like the Environmental Protection Agency and the Madison County local board website, and all of them state that there is no hazardous waste on that side of I-75 on Barnesville Road. And I would talk about how to deal with concerns and ways to deal with them from the people that are being affected, and to measure economic, environmental, and mental health benefits of the park for everyone else there, with surveys, with health records, and the ratings on how people feel about the recreational site. And there are measurable indicators that would be used to measure success, as stated in slide 16 of my second work product presentation. End of my presentation regarding the summary of my NEHA courses. Thank you for sticking around, and have a wonderful time. Bye bye.